Hello, my name is Dr. Kieran Judge, and I'd like to welcome you all to the GI Physiology Lab at the Mercy University Hospital Cork.
I'm Dr. Martin Buckley. I'm a consultant gastroenterologist and the director of the GI lab here at the Mercy University Hospital.
My name is Lucy Quinlivan. I'm the Chief GI Physiologist here at the Mercy University Hospital.
My name's Aidan. I'm a trainee GI physiologist.
My name is Julie. I'm a trainee GI physiologist here at the Mercy Hospital.
New recommendations from the International Anorectal Physiology Working Group have clarified the different types of anorectal disorders. Diagnosis of these conditions require typical symptoms and signs, along with tests of the various steps required to pass a bowel motion. We will briefly touch on these conditions now. However, please feel free to use the progress bar to move forward to the next section. The first category is disorders of recto-anal inhibitory reflex. Under normal circumstances, the internal anal sphincter should relax when the rectum fills with stool or a balloon placed in the rectum by an examiner. However, in this disorder, the internal anal sphincter fails to adequately relax, causing difficulty in passing a bowel motion. This is termed anorectal areflexia. The next category is called disorders of anal tone and contractility. Here, the strength of the anal sphincters are measured by an examiner at rest and with the voluntary squeeze. Normally, the sphincters will have a certain amount of pressure at rest, and this pressure increases when we squeeze our muscles around the back passage. If the resting pressure is too high, this is termed anal hypertension. If resting pressure is too low but the squeeze pressure is normal, then this is anal hypotension with normal contractility. If the resting pressure is too low and the pressure when asked to squeeze is too low, then this is termed combined anal hypotension and hypocontractility. Finally, if the anal resting pressure is normal but the squeeze pressure is too low, then this is anal normotension with hypocontractility. The next category involves measuring the ability of people to push out a small balloon that is placed in the rectum by the examiner, in addition to the pressure tests described above. This category is called disorders of recto-anal coordination. This category is divided into those who can push out the balloon successfully and those who cannot, in addition to pressure measurements of the rectum and anal sphincters during the attempt. Normally, pressures from the tummy and rectum push the balloon or stool towards the anal sphincters, which should relax to allow the stool or balloon's exit. However, in these disorders, poor coordination prevents this process from happening correctly. Poor coordination between the rectum and anal sphincters is called dyssynergia, and this has previously been broken down into 4 types. While this remains useful, the latest classification recommends we call these conditions 1. Abnormal expulsion with normal manometric pattern of rectal coordination. 2. Abnormal expulsion with dyssynergia. 3. Abnormal expulsion with poor propulsion. 4. Abnormal expulsion with poor propulsion and dyssynergia. 5. Normal expulsion with abnormal manometric pattern of rectal coordination. Some people have problems with the sensitivity of their rectum. This can result in pain or discomfort, or even a reduced feeling to defecate. The final category is called disorders of rectal sensation. Here, a balloon is expanded in the rectum to check if people feel the sensation too little or too much. If they feel it too much, then this is called rectal hypersensitivity. If they feel it too little, then this is called rectal hyposensitivity. There is also another category called borderline rectal hyposensitivity.